to look at this important topic. Okay, so first and foremost, I just want to mention that I either shared the PowerPoint presentation on today's session, but if you have looked at the PowerPoint presentation that I shared, it has got a lot of information that we cannot manage to discuss within the few minutes that we have. Okay, so I've just picked some of the important points that we are going to look at that are going to be very helpful. Then for these other information, you can actually be able to read it on your own for further understanding. Okay, so even as Mr. Asbridger is going to be sharing the screen, you see that most of the things that will be projected are not the things that I'm going to be talking about here. But nevertheless, we're going to look at the same topic. We're going to look at most of the information that are in the same presentation, but certain points I'm not going to be mentioning them because of time. Okay, so now today we are going to look at a very important subject, which is mental health. Okay, so when you're talking about mental health, just as the physical health of a person is important, equally is mental health. Okay, so most of the time you find that people, they'll only consider someone to be very healthy if they don't have any physical conditions, they don't have anything that is affecting their physical part. But we tend to forget to say, when you're talking about the health, well-being of a person, even mental health, it is inclusive. Okay, so under mental health today, I wanted us to talk about stress management and also anxiety. Okay, so now because of time, we are not going to look at stress management and anxiety at the same time, but for tonight we are just going to focus on stress management. Then we'll try to ask from the management of Manu Foundation if at all we can be given another session so that we can look at anxiety. So today we are going to look at stress management. Okay, so under stress management, we are going to look at number one, the definition of stress. We need to understand what does it mean when you are talking about stress. Okay, number two, we are going to look at an overview that
are you able to see my screen?
Yes, we are.
You're able to?
You're able to?
You can proceed, please.
You can proceed, please.
Okay, so we are going to look at the definition of stress. Then from there, we are also going to look at just an overview of the statistical data of stress, especially in our country, Zambia. Then from there, we also look at, the physiological changes that occurs in the further look at, some of the factors that can lead or that influences someone to be stressed. Then from there, we are going to look at the last objective, which is how can someone be able to cope with the stress. Okay, so now before we begin, I just want to give an overview of the statistical data of stress in Zambia. Okay, so when you talk about stress, this is a growing concern in Zambia. Okay, and this stress, it is not only affecting young people, it is not only affecting children, but it is something that is affecting everyone in all walks of life. Okay, and according to the survey that was conducted in 2024, it showed that 62% of Zambians, they were reported experiencing stress. Okay, so if you look at the Zambians population in 2024, about 62%. Now we are in 2025, simply means that even maybe the statistics, the numbers, there's an increase. Okay, and among these 62%, it showed that 45% that were stressed, it was citing financial difficulties as the primary cause. Okay, so you find that from this percentage of people in Zambia that were stressed, according to the statistical data, it was indicated that the primary cause of the stress of many people in Zambia, it was financial difficulties. Okay, now if you look at Zambia, we have got a lot of provinces, but under this survey that was done, three provinces were highlighted as the most provinces where most of the people, they were, culprits of stress. Okay, number one province, there is Lusaka province. Okay, and Lusaka province, because of the population that is there, it had to score about 71% of the population that is in Lusaka province. They were found to be stressed people. Okay, even Copperbelt province, it had about 65% of people that had to undergo stress. Okay, and apart from that one, the other province that were indicated in this survey that was done is Southern province, which recorded 58% of people that were stressed. Okay, now why were these people stressed? Okay, so according to the survey, it indicated that the leading cause of the stress in Zambia include the following. Okay, I want us to understand this statistical data because stress, it is one of the psychiatric disorder that is affecting almost everyone. Okay, so now what did it show as the leading cause of stress in Zambia? Number one, we have got financial difficulties, and financial difficulties, it showed that 45% of people that undergo stress, it is as a result of financial difficulties. And I'm sure everyone will be able to agree with me, especially nowadays with the way the economy is, with the way it is hard to find a job, the way it is hard to find money. You find that people each and every time, they are living lives of stress. Why? Because of financial challenges. Okay, number two, it is health concerns, and it showed about 31% of people that were stressed, it was as a result of health concerns. So you find that especially when people, they have got chronic conditions like diabetes and other diseases, they tend to undergo stress. Okay, and apart from that one, the other point is work related issues. Okay, which showed 25% of people that were stressed as a result of work related issues. So you find that at work, because of work overload, because of conflicts at work and other things, most of the people, they tend to get stressed. Okay, so now why do you want to talk about stress management today? Stress management, it is a very important topic that we need to understand. Why do we need to understand? It is because every person undergoes stress. Okay, every person undergoes stress, and just as we are having this presentation, we even have got some participants that can even be able to give a testimony to say, I'm even stressed today. Why? Because it is something that has become part of each and every person because of the environment where we are living in and because of different factors. Okay, so now let us look at the definition of stress. Can I have someone that can define stress? What do you think comes into your mind when you're talking about stress? What is stress? Anyone to help me with the definition as we move? Anyone that can help us to define stress? Anyone? What do you understand by the term stress? Because we usually use this word. You find that if someone is trying to call us, this terminology in our daily life. So now, what what do you think stress is? Okay, I've seen Madam Joy. You can unmute yourself and just give us a definition. What comes into your mind when you talk about stress? Okay, so I don't know what is happening with Madam Joy. Can we have another one that can help us with the definition of stress? Fernando change. Yes, you can help.
So, in my own opinion, I feel like stress, this is so it can be emotional, it can be physical.
All right, thank you so much. Can we also have another person that can give us a different definition? What do you understand by the term stress? Anyone? Anyone has got something to say? Madam Chimunya, our co-host, what do you understand by the term stress?
Okay, so I would say stress is a state of mental or emotional tension, like a difficult time, and it's hard for you to process your emotions and also mental health in check. So, yeah.
All right. Thank you so much for all the definitions that you have given. Okay. So, in addition, when you are talking about stress, stress it is just a natural physical. When an individual feels overwhelmed, that's why you find that if an individual, for example, you are feeling overwhelmed, you are going to end up being stressed. Okay, if someone is anxious or if someone is unable to cope with a certain situation, you need a 2,000 kwacha that you are supposed to pay tomorrow in the morning. That is the challenge that you have. And currently, you don't even know where you can actually be able to get that amount of money. So what is going to happen, there will be a natural physical and a mental response to that challenge that you are having, and it is going to make you to be what? Stressed. Okay, so now I want you to understand what happens in your body when someone is stressed. Okay, now let us look at the physiological changes that happen in the body when someone is stressed. Okay, so what happens is that when an individual experiences stress, okay, their body's fight or flight response that is triggered. Okay, so for example, if I'm undergoing stress, there are certain hormones that are triggered in the body. Okay, and once these hormones they are being triggered, what are they going to do? They are going to prepare the body to either confront the threat or flee from it. Okay, so now let me just give a simple physiological change or changes that occur when someone is stressed. Okay, so if you look at the way our brains are, everyone has got a brain. Okay, so the way the brain is, it has got a small region that we find in the brain that is called the hypothalamus. Okay, so what happens is that this hypothalamus, if a person is stressed, it is going to send signals to what we call the adrenal glands. Okay, and these adrenal glands, they are the ones that are responsible for releasing what we call the stress hormones. Okay, so once the adrenal glands they release the stress hormones, for example adrenaline and cortisol into the bloodstream, what happens is that this adrenaline, it is going to increase the heart rate. So the way the person will be breathing or the way the person heart rate is going to be, it is going to increase. Okay, even the BP, the blood pressure of the person is going to increase, and also the energy levels they increase. And you bear with me that if someone is stressed, they can be able to stay the whole day, even 2 days, even 5 days without eating. Why? Is it that they don't feel hungry or what? It is because of these hormones that are being released. Okay, so they are going to increase the energy levels. This person is going to be feeling energetic whilst there is nothing in the stomach. Okay, because of adrenaline. Okay, apart from that one, there is also a hormone that is called cortisol. Okay, so this cortisol, what it does is that it suppresses the immune system. It is going to slow down digestion and it is going to increase blood sugar levels. Okay, remember, you find that if someone is stressed, they'll be able to eat something, but for digestion just to be completed, it will take time. Why? Because they are stressed, and once they are stressed, there are some physiological changes that occurs in the stomach that will make a person digestion process to delay. Okay, and apart from that one, there is also the release, okay, of dopamine. Okay, so when you're talking about dopamine, it is the one that is involved in motivation, pleasure, when you are feeling nice and etc. It is because of this dopamine. Okay, but this dopamine, when someone is stressed, what happens is that it is going to disrupt, especially chronic stress. Okay, so these are some of the physiological changes that occur when someone is stressed. Okay, now when you're talking about stress, you need to understand that stress, it is a normal thing. Okay, it is a normal thing. Being stressed, it is a normal thing. Why? Because in the environment where we live, we have got a lot of factors that can trigger someone to be stressed. Okay, and we can't run away from this truth. Whether you like it or not, you find that before the day ends, people, they tend to get stressed with different things because of different factors and etc. that are found in the environment. Okay, but what is important is managing stress. Okay, because once we fail to manage stress, it simply means that it is going to go into complications, and these complications can lead even to what we call psychiatric disorders. Okay, so now when you're talking about stress, it is classified into two. Okay, when you're talking about stress, it is classified into two. Number one, we have got what we call acute stress, and number two, we have got what we call chronic stress. Okay, so now what does it mean when we talk about acute stress? Okay, so acute stress, this is the type of stress that can actually occur for some hours. This is the type of stress that can occur for only a few days, maybe 1 day, 2 days, 3 days, and it ends there. Okay, that is what we call acute stress. Okay, but on the other hand, we have got what we call the chronic stress. Okay, so what does it mean when we talk about the chronic stress? So the chronic stress, this is the type of stress that can take more than 1 week. It can take more than months, and it can even take more than years. Okay, you find that there's just people that are stressed for 1 month. They have just been stressed, okay, because of different circumstances. And there are people that you find they will be stressed for 1 week, for 2 weeks. So all that, it is referred to what we call chronic stress. Okay, so you need to understand. So now let us look at the factors that contribute to stress. Okay, let us look at the factors that contribute to stress. But before we can go that far, maybe if there are questions or contributions on what I've actually said, you can just raise the hand, then I'll give you the platform so that you can say something or ask before we look at the factors. And you just bear with me. I'm trying to be a little bit fast so that we can cover most of the important information, but I'm sure audible enough and you're able to understand. But if you are behind, you can actually be able to tell me so that we move at the same pace. So do we have questions or contributions before we move? Okay, so it seems we don't have questions, and it is loud and clear. So if maybe the question or the contribution is going to come afterwards, we can still keep it. We'll give you the platform so that you can actually be able to ask. Okay, now let us look at the factors that contribute to stress. Okay, so what are some of the factors that you think, or what are some of the causes of stress? Okay, so before I can explain something, I'll just request everyone to participate because everyone has undergone stress. Okay, and as we are speaking now, we even have got people that are stressed because of various reasons. So you can give us those reasons so that we can add them on the points that I have as to the factors or the causes of stress. Okay, so we are going to begin with Fernando. Fernando. Do bear with me if I haven't pronounced your name very well, but you can give us maybe 1 or 2 points. What do you think are the common factors that contributes to stress? So, Mr. Asbridger, you can remove the slide. Yeah, okay, thank you. So, anyone, we can start with Fernando. You can give us, what do you think is the cause of stress? What causes people to be stressed?
Some of the things that causes a person to be stressed, we say people ending with maybe the family's situation at home, maybe they are going through something. At times it might even be sickness. You might be stressed because your health isn't well or other things.
All right, thank you so much. That is very wonderful. Can we have Sister Joy Murenga? Yes, what do you think are the causes of stress? Or the time that we are stressed, what caused that stress?
Okay, so for me, mostly I get stressed about recently. I got stressed about school studies because we were supposed to. I'm a first year student at CPU, so we're supposed to write our end of term tests, and I was very stressed because I didn't know anything.
All right, thank you so much. That is a good point. Can we have Madam Chimunya? What caused the stress that you had? Or what do you think are the causes of stress?
Okay, so I feel like this one was the acute type of stress. It was very brief, and it happened the first time I was asked to moderate. Yes, for a webinar actually, and that was my first time. So exposure to new things can also cause stress, but for a short period of time.
All right, thank you so much. That is a very powerful point. We have gotten something. Madam Subongiri, can we have some of the causes? What do you think can trigger stress?
One of the
All right, thank you so much. Mr. Asbridger, you can as well say something. What do you think are the causes of stress?
Alright, for me, always it's money. When I'm broke, I
The hours that are not even expected according to you as a human being. So you find that because of that, a lot of people, they tend to get stressed, okay? And also work overload. You find that maybe you are doing overload of the work. You find that a lot of people, they tend to get stressed. Especially, I'll give a practical example to nurses and doctors. You find that maybe you are working at a certain facility and you are attending to a lot of people. You find that you attend to them, another group of people, they come. So because of the work overload, a lot of people, they tend to get stressed, okay? So there are different things that happens at work, even conflicts. Maybe between, workers, they start having conflicts, they start having some differences that can actually be able to trigger someone to be stressed, okay? Apart from that one, Mr. Asbridger also mentioned about financial difficulties. And remember in my preamble, when I was giving the statistical data, it was indicated that the issue of financial difficulties it is one of the top factor that is contributing especially to stress, okay? Especially in the world that we are living today. The economy, it is something that is very hard. People, they are tending to find difficulties to find money, and because of that, a lot of people nowadays, they are living with stress, okay? And it might not be active stress. For example, maybe you are married, okay? And maybe where you are working from, they are giving you a 400 kwacha or maybe a 500 kwacha, and you have got a family, and the house where you are staying, you are also renting. Do you think that person will be happy? No, they will always be stressed because they will be thinking about financial challenges. So financial difficulties, it is also one of the factors that can trigger stress, okay? Apart from that one, also debt and employment levels, especially in Zambia, you find that you can finish your course, you can do whatever, but finding a job, it is something that is very difficult, and most of the people, they tend to get stressed, okay? Then the other point that you people, you are not mentioning, it is the relationship problems, okay? So especially for people that are in relationships, okay, you find that the issues of, family, friendships, boyfriend and girlfriend, sweetheart and nanny, they tend, to go to have different issues in relationships, and because of that, people, they go into stress, okay? You find that, or maybe someone was promising to say, I'll marry you, then they dump you. What will happen? You will definitely go into stress. As a result, you might develop maybe even chronic that can bring about other complications, okay? Then we also mentioned about health concerns, especially people with, chronic conditions. For example, maybe I go for HIV testing, and I just find that, I'm HIV positive, and, maybe you didn't even expect to say you are HIV positive, then you are just told to say you are HIV positive, or you go to the health facility, they tell you, you have got diabetes, you have got maybe hypertension, and different health conditions, and because of that, people, they tend to fail to accept at first, and most of the people, they tend to go into chronic or acute what? Stress, or maybe loss of a loved one. Someone mentioned about this one. You find that you lose someone that is dear to you, and because of the relationship and everything that you had with that person, most of the people, they tend to go into stress, okay? And the last point, but not the least, on the factors that can trigger stress is trauma, okay? So for example, maybe if someone it is physically abused, emotionally abused, maybe they were abused psychologically, and because of those tragic events that happen to them, it can actually be able to lead to stress, okay? So these points and other points that you have actually mentioned, they can actually be able to trigger stress, okay? Now let us look at the effects of stress, okay? What are the effects of stress? So remember, we classified stress into two. We talked about acute stress, and this stress, you might be stressed maybe for hours, you might be stressed for minutes, you might be stressed maybe for a day or for 2 days, for 3 days, for 1 week, and it will end there, okay? Now, chronic stress, I mentioned to say this is the type of stress that can actually, that is grad, okay? So you find that it can even take, 1 month, it can take more months, it can take even years. Someone is just stressed, okay? So now, if someone is having chronic stress, it can lead into the following complications, okay? So if someone is having chronic stress, you find that it is going to lead to the following complications, okay? Number one, it is a psychiatric disorder, okay? And by the way, I forgot to mention this. If you get stressed, okay, or maybe you have got depression, maybe you didn't know, it's a psychiatric disorder. It simply means that you are mad, okay? That's to say no one is normal. Why? Because each and every person has got a disorder, okay? And when you're talking about disorders, the only difference that is there is that we have those that have got major mental disorders, and those are the people that we see moving around, picking, dirty and etc. But we also have us, including myself, that has got minor mental disorders. Okay, so because of the minor mental disorders, we feel as if we are all normal, but the truth to be told is that no one is normal. Even the facilitator that is speaking is not what normal. Okay, so now the first complication, chronic stress, it is a psychiatric disorder that we call anxiety and depression. Okay, so you find that if someone is having chronic stress, if they keep on being stressed for weeks, if they keep on being stressed for years, for months, you'll find that this person is going to develop anxiety and depression. Okay, and if someone is depressed, you find that these are the people that lose motivation to do things that they love. Why? Because of stress. It has triggered anxiety and depression. So that is the first complication of chronic stress. Okay. Number two, it is insomnia and sleep disorders. Okay. So you find that if someone is stressed, they tend to develop insomnia. So what does it mean when you are talking about insomnia? So insomnia, this is where a person fails to sleep. Okay, I'm sure, especially you are in a relationship, or you have got a financial challenge, or maybe you have got something that is troubling you and you become stressed. You find that most of the times it becomes very difficult to sleep. Okay, you can even stay the whole night without sleeping. Why? Because it is a complication of stress. It has caused insomnia and sleep disorders, but it differs according to persons. Okay, so you find that other people, maybe they'll be sleeping too much because of the stress, and others you find that they'll be awake for the whole night, the whole day they are just awake. So it is a complication of chronic stress. Okay, number three, digestive problems. Okay, there will be digestive problems. Remember, we mentioned to say that because of the hormones that are being released, you find that they are going to increase the glucose levels in the stomach, and it will make the person to be feeling as if they are full. Unless they are not full. Why? Because the hormones that are responsible for that, they have been released. That is the reason why you find that people that are stressed, they can stay even without eating. Okay, for example, if you have lost a loved one, people at funerals, we see they can stay even for 1 week, for 2 weeks, they haven't eaten anything. Okay, you give them this food, they'll be refusing. Why? Because they are stressed, and because of that stress, they'll be feeling as if they have got food in their stomach, what else they don't have. So it can also lead to digestive problems. Okay, or sometimes if they eat something, you find that the digestive process, it is going to delay. So those are some of the complications that may come as a result of chronic stress. Okay, then the other one, we have got the weakened immune system. So the immune system, it becomes weakened when someone is stressed. Okay, that is the reason why you find that because of stress, there are certain things that will be released in the stomach and other things that can actually make even your body to be immune compromised, and also skin problems. So you find that certain people, when they are stressed, they develop acne or pimples. So you just see the pimples to other people, and you'll be able to tell that this one is undergoing stress. Some people, they tend to develop eczema. Others, they also lose their hair, and there is also weight gain or loss. Remember that it happens in both sides. So you find that certain people, when they are stressed, they won't be eating, and what will be the consequences of not eating? They are going to lose weight. Okay, but there are those that you find that when they are stressed, they will be eating too much. Okay, and you'll be surprised to say, are you going through something new that is hard? No, it depends with the type of an individual. Okay, so it is not everyone that will not be eating. Others, they will be eating, but the kind of eating, it will be a too much kind of eating. Okay, so these are some of the effects or complications that might come as a result of stress. Okay, and I can give practical examples. For example, maybe you are a student. Okay, and maybe you are experiencing stress due to an upcoming exam. You find that you may feel anxious, you have trouble sleeping, you have experiences with digestive problems. And this is why I think we see even students, they can be able to stay from morning up to evening. Some will come back from school busy on books, If you tell them, are you not eating? They'll tell you, no, I'll eat later. Why? Because they are stressed, and that stress has led to some digestive problems in their body. Okay, so these are some of the effects or the complications that can come as a result of stress. Okay, so we have talked about a lot of things concerning stress. We have talked about the definition. We have talked about different types of stress. We have talked about the factors that can trigger someone to be stressed. But the most important thing we need now to look at, how can you be able to manage stress? Okay, because if we can talk about the definition, we talk about the causes. If we don't talk about the management, it simply means that we haven't done anything, and this is the most important part that we need to focus much on. Okay, so we have talked about different things that trigger stress, and in my presentation I earlier mentioned to say being stressed, it is a normal thing. Okay, but it becomes abnormal when you fail to manage your stress. Okay, and this is where we have got a problem. We have got a lot of issues where people have committed suicide just because of stress. Okay, just because they were stressed about something, and they go into depression, anxiety, and we hear people, they have killed themselves. Okay, and because of stress, this is where we have seen maybe someone is having financial challenges, especially ladies. They'll go into prostitution because of stress, because they need money. As a result, they tend to have sexually transmitted infections and also HIV. And if you have seen, especially in our country, Zambia, there is a high rate, or a high number of youths that are infected with HIV. Why? It is as a result maybe of stress. People that are stressed with issues to do with financial challenges, they are stressed with personal issues. As a result, they tend to engage in other vices just to make end what meet. Okay, so now let us look at the management. How do you think we can actually be able to manage stress? Okay, what are some of the coping strategies that we can use to manage stress? Madam Chimunya, what do you think? What are some of the coping strategies that can help us to manage stress?
Some of the strategies we could use to manage stress. Like, I know I've been stressed before, but I'm trying to think of something that I did to manage stress.
Okay.
Sometimes, one of the easiest ways to manage stress, especially if someone is dealing with personal issues, like someone said, when you lose somebody that you love, the easiest and most common and relatable thing that people do is talk to someone. It can be a friend, a family member, or even counselors, especially for students.
All right, thank you so much for that contribution. Okay, so now because of time, let us proceed and look at the coping strategies that can help us to under stress. Okay, so if you look at the slide or the PowerPoint presentation, there are a lot of details there. There are a lot of details on how you can actually be able to cope with stress. But just as I mentioned in my preamble, is that I won't be mentioning what is there. What is there, you are going to read yourselves, but I've just made a summary of most of the important points that you need to take note from this presentation. Okay, so now I've classified the coping strategies of stress into different categories. Okay, so the first category, it is called the physical coping mechanisms. Okay, so when you're talking about the physical coping mechanisms, what can you do to be able to cope with the stress? So number one, it is exercise. So regular physical activity, it reduces stress. So most of the time when you are stressed with something, just make sure that you do an exercise. Okay, so we have got different types of exercise. If you are able to play football, you can play. If you can be able to jog, any type of exercise, you can do it. Okay, and if you are doing regular physical activity, they are going to help you to reduce stress and anxiety by releasing what we call endorphins. Okay, so endorphins, it is just a hormone. So the more you are doing the exercise, you find that this hormone is going to be released, and it is going to help you to cope with the stress. Okay. Then the second point under physical coping mechanism, it is sleep. Okay. You find that most of the people, we don't get to have enough hours to rest. Okay. So you find that someone will just be on social media, for a lot of hours. You are busy with studies, you are busy with different things, and you tend not to have enough time to sleep. So that can actually be able to make you stressed. So sometimes when you are stressed, make sure that at least you sleep, you take some hours, and that is going to help and improve your mood. Okay. Then apart from that one, there is also what we call the emotional coping mechanism. Okay. So this is where you need to seek social support. So Shimonia mentioned about this. So you find that if you have got maybe a problem, you are stressed, you can actually be able to share it with your social support group, or your friends, or your families, or anyone that you trust, and they can actually be able to help you to cope with the stress. Okay. Then apart from that one, there is also cognitive coping mechanism. Okay. So under cognitive coping mechanisms, this is where now you need to have to solve the problem. So you can identify the problem that is contributing to the stress and develop a plan to tackle them. Okay. And remember that you find that most of the stress that we tend to have, it is a result of problems and not focusing much on the problem. Okay. And there's also lifestyle coping mechanism. You need to be implemented. You just go out, okay, or you just go somewhere, you have some leisure time. It also helps to cope with the stress. Okay. And also time management, it is also important. So you need to establish a routine and stick to it to reduce stress which is caused by poor time management. Most of the time you find that our stress that we tend to have, it is a result of failing to manage our time properly. So you need to have a good management of time. If you say this time I'll be studying, this time I'll be doing this time I'll be doing this time I need to do this, you find that if you abide by that, it is also going to help you not to be getting stressed. Okay. Then the overall point is that if you get stressed, especially for several days, it is important that you seek professional help. Okay. There are certain situations where you find that you try to talk to someone, you try to apply different techniques, but you are still stressed. Okay. So what you need to do is that you need to seek professional help. And where can you be able to seek this professional help? You need to go to the nearest health facility, you explain to them, and they'll be able to provide psychosocial counseling. And especially in chronic stress, you find that you try counseling someone, you try doing this and this, it is not happening. So there are certain drugs that are given just that help that patient or a client just to go back to the normal. Okay. So these are some of the coping strategies that you can apply to manage stress. Okay. So I'm done with the presentation. So I'll now just allow questions and contributions. Strategies, and those that I've mentioned are the simple ones that can actually be able to help each and every person to promote or to cope with stress. Okay. So questions or contributions. If there are no questions, I'll ask questions. So do we have questions or contributions? I've talked about a lot of data here, so I expect a lot of people to have questions, because stress, it is something that has become part of us. So okay, so I've seen, we'll start with Joy Mulenga, then we'll have Madam Chimunya, so we can follow that order. Madam Joy.
So on the stress management, you talked about opening up to someone. Also, Madam Chimunya talked about it, or rather, let me say, visiting the health facilities. But I don't think many people know about that, to say when they have these kinds of stress and challenges, emotional challenges that they face, that they can go to health facilities. And I think that is due to the lack of proper sensitization from these health facilities. And also, I think people feel scared because of the stigma that's there, to say, okay, if I go, maybe let me say to China, because of how people tend to say, oh, no, Bantu Bamnama China, my says those people that are mad. So I feel like there isn't proper sensitization about mental health and in connection with health facilities.
All right, thank you so much for that wonderful point. I'll be able to say something. For now, let me just allow Madam Chimunia to come in.
Okay, thank you very much. I even feel like part of what I was going to say has already been said by Joy. It's not a question, it's more of a contribution. I really love the fact that you've mentioned that stress is normal. When it's in moderate levels, this is a very normal thing because it can help us stay motivated for us to achieve our goals. And it can also even allow us to get out of a state of fear, you know. So it's funny how simple things can help us to manage this stress, because after learning about stress, I feel like the most important thing is we should be able to manage it whenever it becomes abnormal or when it becomes detrimental. So it's from the simple things such as sleeping, planning your day out, whether a night before or in the morning. It's by exercising and talking to friends. And yeah, I just want to encourage people that are here to say that, you know, you've received this information, right? As Miss Joy mentioned, to say sometimes people are afraid because of the stigma that's around mental health. And not to shame anyone, but let me talk about the guys. When Mr. Asbrida and I were talking yesterday about like people that come to these sessions, and then we're comparing the number of people that had registered for this session and the upcoming session, we find that there are few people who say they're going to attend this, because some people will look at mental health and just be like, ah, mental health, especially guys. You guys should change, because there's nothing wrong with like undergoing stress or being depressed and being anxious. So for you guys that are here, my word of encouragement is, with this information, you know how sometimes stress can look like for some people. You can tell, let's say maybe from their weight, somebody has just lost weight, especially students, because of studying. And sometimes you have to tell this person is stressed. But then when you're telling this person, you should stop stressing, they're like, I'm not stressed, I'm not stressed. So you know what that looks like. Spread this information to your friends, so that you know there's nothing shameful in like being stressed from time to time, um because stress is normal, but then when it's abnormal like that, you need a friend to look out for you. So yeah, that's just my encouragement to everyone. Thank you.
All right, thank you so much. So just remaining with 2 minutes to come to the end of the presentation. Let me just make my last remark. Okay, I've seen Fernando. Okay, so Mr. Albrito, maybe you can bear with us. Give us 5 more minutes so that I can just accommodate more people that have got questions and contributions. Then we can come to the closure. So, Fernando, yes, you can.
That's a contribution too. I would like to refer to a Bible verse in Proverbs verse 25. It says that anxious care in the heart of a man is what will cause it to bow down, but the good words is what makes it to rejoice. Most of the time we should connect with others, because we should not hesitate to turn to our parents or friends for assistance, because when they support us emotionally, it reduces the damage that is increased by stress. Stress brings to our heart, blood vessels, or immune system. Then the other thing that you also talked about is the care for our body. We should always make sure that we get enough sleep, get the regular sleep from time to time, and allow ourselves to unwind, have a lot of time to go through things. And what also helps me is one thing is that we should not exercise within 3 hours before going to bed, and we should avoid heavy snacks and caffeine when we are nearing bedtime. I think if we can do that, that would help us to reduce stress.
All right, thank you so much, everyone, for that powerful contribution. Do we have anyone that would want to say something before we conclude? Okay, so do we have anyone? Okay, so it seems we don't have. Okay, I've seen a hand. Okay, Cleopatra Msonda, you can unmute yourself and give us your question or contribution.
I have a contribution on something that helped me personally to handle stress. So one that can be done is finding some activities that you enjoy. When you're feeling okay, then you write them down. And when you feel like you're about to get stressed, or maybe you can be doing these activities every day. Like every day, change each activity to do. Today you do this one, tomorrow another one, tomorrow the other one. Those that makes you to feel happy, they actually help. And also another thing that can be done to make someone to be less stressed is writing down the things that were good about their days. Let's say something that made them happy that happened, instead of focusing on the bad things that happened. Maybe writing down just 3 points about the things that you appreciate about your life today. Such things can help. Thank you.
All right, thank you so much. So a lot is instead of the stress, and one thing that I just want to mention in my concluding remarks is that stress, it is something that is very normal, especially when it is mild or moderate. But once it becomes severe, it can actually lead to a lot of psychiatric disorders. Okay, so let us ensure that whenever we feel stressed, because we can't run away from stress, just as I mentioned, because we have got a lot of factors in our environment that trigger us to be stressed. Okay, so but what is important is that whenever we get stressed, then because failure to cope with the stress, it can lead to psychiatric disorders such as anxiety, depression. You find that even people, they tend to be admitted at mental hospitals, okay, and they'll be under management because they just failed to manage stress. Okay, and the other thing is that in our communities, at our workplaces, at school, whenever we be found, we might encounter people that would be going something and they are stressed. Okay, so let us ensure that instead of stigmatizing them, but let us help them so they can actually be able to come out of that stress to prevent other complications. Otherwise, thank you so much for hosting me, and this has been a health, but forgetting that mental health, it is also important. Thank you so much, and I'll just leave it now to Mr. Asbridge and the team to continue. Thank you.
All right. Thank
Thank you so much, Mr. Comfort Mwansa. We appreciate for sharing knowledge on how to handle stress.
Other factors that we didn't know
that contribute to the stress.
Healthy.
to our health.
This marks
So
the end of
this marks the end of
look out for other
session.
sessions that we're going to
Look out for other sessions that we're
soon
going
be having
to
another
be
session
holding. Soon we'll be having
business
another session
and
about
staying
outreach
compliant
as
in
a
Africa.
business
So
and
please you can check
staying
out my
compliant in
academic group,
Africa. So
and
please you can check out
we
in
have
our
a team
academic
here
group,
to present.
and we have a team here that is present,
Madam
Madam Chimunya Himonga
to be our
and
CEO
Madam
for
Anja Pili, who happens to be our
Manu Foundation.
Manu Foundation.
So Madam Chimunya
Himonga
for us
is going to close for us with remarks and other information that we can
have as a takeaway.
Okay, thank you very much, Mr. Asprija. So we've reached this is the end of our discussion. I just want to thank everyone who's made it here. Thank you for taking some time out of your schedules to be a part of us and to learn something. Also, many thanks to our distinguished guest speaker, Mr. Comfortance. Honestly, I learned a lot and really loved being here. I just want to encourage everyone that what you've learned here, please put it into practice. It's funny how stress is going to deprive you of your sleep, but for you to fight that stress again, you need to sleep. So it's from those simple things that we've learned. Talking to friends, exercising, and even reading the Bible. Honestly, I like that Mr. Fernando talked about that. So thank you very much, everyone. I think everything has already been said. Do engage with us on our socials. It's My Foundation. We're everywhere. Thank you, guys, and have a good night. But I think we're supposed to pray before we go and sleep. Did you guys pray before you open this meeting? Please respond fast. Did you guys, you prayed? Okay. So I'm going to close in prayer. So, our gracious and loving Father who dwells up in the Most High, thank you, Lord, for the gift of life that you've given unto us. Thank you for this opportunity to be here and to learn about stress and stress management, Heavenly Father. Even as we do this, let us not forget your word, and as we go to bed, I ask for protection that each and everyone who's in this webinar, Lord, may be protected. In Jesus' mighty name, I pray that's in my heart. Amen. Alright, guys, good night. Bye.
You can leave your COA.
You can leave your COA.